you via my wife.
Okay.
I'm curious, where does mucus and snot come from?
Okay.
And why do we have it? What is its purpose? How do we make it? Why is there so much?
Yeah.
Obviously, we're dealing with some congestion in our house. So that's the topic.
Okay.
Thanks for your help.
Well, I mean, mucus comes from
It's mucous membrane, bro.
So everything in the human body has to, I mean, we can't transport stuff across air in the human body. So cells have to get from one place to another through fluid, and to allow that to happen, so we have fluid in the interstitial fluid, which is between the cells and in the cells, and then we have extracellular fluid, which is like blood and stuff like that, that's outside of the cells, and all of these things help to transport things from one place to the other. We just really don't have a way to do it otherwise. And mucus serves a lot of different purposes. One is just pure protection. Tacey, you want to talk about mucus in the stomach for a second? You're an expert on that.
No.
No. Okay, fair enough.
I don't care. I don't care.
Mucous membrane in the stomach has things, contains proteins and prostaglandins and other substances that would protect the stomach from stomach acid so it's not digesting itself. And then the mucus in your mouth keeps, if you've ever had dry mouth, you notice that your teeth start to go bad, and because they need to be constantly washed with fluid, and, stuff collects in your mouth and all that stuff. So that's why we have saliva. Saliva also has enzymes in it that help to pre-digest carbohydrates. So if you take bread and you chew it up and just keep chewing it and chewing it and chewing it, and you leave it in your mouth, it'll start to turn sweet because it's turning the enzymes in your saliva are turning that bread into sugars. So it's transporting enzymes, but also facilitating swallowing of food and that kind of stuff. Now in the nose, it's a little bit different. My hypothesis has always been that, sadly I have to use a teleological explanation, where there's purpose, where no purpose actually exists. But it was sort of designed to get antigens out of your nose. One of the functions of the nose is to trap dust and allergens and pathogens and stuff like that in the vibrissae of the nose. And the mucous membrane will also, stuff sticks to it like flies on fly paper. And then if it is a particularly repugnant antigen, then it will stimulate a histamine response. And when histamine, and here this gets to the second part of his question, where does it come from? Histamine will allow the transport of hyperfiltrated blood, aka water, basically, with some proteins in it that make it sort of gushy, from the capillaries to the outside world. So the capillaries open up, and this is why you get congestion as well, because when the capillaries open up, the volume of fluid in your nose increases, so that decreases the airway space, and then this ultrafiltrated blood that has no red blood cells in it, and that's why it's clear, is excreted across the membrane, and then it starts flushing stuff out. And this happens in the lungs as well when you have pulmonary congestion. And it can also happen, but this is not really mucus, when people have congestive heart failure, but that is a pressure problem. That's where they, it's like a pipe, not a pipe up, a pump that has gotten overprimed,
right,
and it backs up, and the pressure is so high in the capillaries of the lungs that that fluid is secreted into the lungs, and it decreases the ability to transport oxygen from the outside to the inside, and you get short of breath, and then it can be a vicious cycle. But that's basically congestive heart failure. Yes. But what he's talking about is the response to allergens in the nose causing histamine response and other things. That's why you take an antihistamine. And if you want to get rid of congestion in your nose quickly, you can take Afrin, which is oxymetazoline. Be careful because it is habit forming. But if you use it, you'll notice it works almost right away because it's a vasoconstrictor. It constricts the capillaries in the nose, and when that happens, it's the opposite. You have decreased volume of fluid in the tissues, and then the airways open up. That stuff's like magic.
You could use it Simply Herbal's nasal spray. Wash that shit out, man.
Well, you could, yes.
Oh yeah, you didn't
literally
talk
wash
about
it out.
Absolutely
Literally
right.
wash it, yeah.
Yeah, you can
That's another option.
You can wash the allergens out, and then you're just that way you're doing the body's job for it.
You're helping it. Yeah, you're helping it.
Correct.
Yeah.
So if you spray that, I've sprayed that stuff up there, let it sit for a minute, and then just blow it back out again, and that very often helps. Particularly during periods where I've gotten into pollen or something like that. And then the other thing, and Dr. Scott would rather that you use his product at simplyherbals.net, but I really like the Navage.
I like the Navage too.
The
It works
Navage
extremely
is
well.
an electric neti pot where you don't have to look as stupid doing it. Just
Wow.
Google
I might disagree. I think it's worse. Don't you think?
Yeah.
No,
It looks
no.
like you're being attacked by an alien.
Go
Who knows?
Google neti pot, Google image neti pot, and all those people look stupid as hell. I know it feels good and it works, but you just look like an idiot. Whereas this thing looks like you've just got a medical device attached to your face. So, well,
No, I know.
you all decide on your own.
Yes.
Look at it, and whichever one you feel least stupid doing. Now, the neti pot's a lot cheaper, but use distilled water and use saline. Do not use just.
But nasal lavage, I think, is far superior to washing the crud out.
Correct.
Yeah,
Correct. Either way, however you do it, but use distilled water. You don't want amoebas and other things, paramecium getting up in your nose, and amoebic encephalitis can be fatal. It's very hard to kill once they get in there. Be careful with hot springs if they're not hot enough, too. And fresh water, when you dive down and you get that stuff up in your nose, just make sure that you're in an area that's known to be safe with their fresh water and they've never had any amoebic encephalitis cases.
Right.
I don't swim a whole lot in fresh water anymore. Salt water, no problem.
No.
Give me a shark any day.